Back now with your health, and as we told you, there are two big medical stories that we're following this morning. So we brought back in Dr. Azar. This is one about the shakeup in the weight loss industry. The FDA just approving the popular drug Wegovy in pill form. Until now, it had only been available as an injection. Dr. Nat here with everything you need to know. This seems like a game changer.
It is. I mean, we've honestly been talking about when is an oral version of a GLP-1 going to become available and approved, and here it is. It is. I mean, economic experts are saying that the pill could take up to 24% of the market share, which, as we know, is pretty astronomical. It's great. Patients will now have a choice, potentially, right, as opposed to doing an injection, taking something by mouth. And this is something that is meant to either be, sort of an initial treatment for weight loss, as well as reducing the risk of heart disease, or as maintenance after you lose the weight with an injection, maybe switch over to a pill.
So can we talk effectiveness for a second? We got pill on the one hand, we got shot on the other hand. In terms of effectiveness, potential for side effects here.
Yeah, so what's really kind of interesting about this is that we usually think of a pill being slightly less effective than the injection because it has to get broken down, in the gut. But actually, the numbers look pretty comparable. It was about 13.6% of body weight with the pill, as opposed to about 15% with the injectable version of Wegovy. In terms of side effects, the same things that we expect with the injection were seen with the pill, such as some nausea, diarrhea, constipation, abdominal pain. The one little, I would say, wrinkle with this medicine is that there are some restrictions about when it is to be taken. It has to be taken on an empty stomach, first thing in the morning, 30 minutes before eating or drinking anything else. Compliance could be an issue. I was just talking to someone who said, you know what, I'd rather do an injection once a week. It's easier to remember, but it's definitely something, more tools in the toolbox, and it's just an economic supply and demand. It's great to have more choices in the market.
You could just assume that maybe a pill would be cheaper because you're not actually selling the injectable, the packaging. Is it less expensive?
One would assume. So right now, we've heard that the price for the starting dose, which is 1.5 milligrams, is going to be $149 a month. But that's the starting dose. The maintenance dose is 25 milligrams. So Novo has not yet reported on what the higher doses will be. They'll probably edge up closer to not necessarily the commercial price now of about $1,000, but maybe half that.
I got to follow up. If Wegovy, did they crack the code on going from injectable to pill form, where the other manufacturers now, is this a tipping point? They'll all go to pill?
So we are anxiously awaiting the approval of Lilly's oral drug, which, because it doesn't have those restrictions around eating in terms of empty stomach or not, may actually edge out the Wegovy pill. But, these two companies have been going head to head now, right, for a long time. I think time will tell which one is going to come out on top, but there are other ones that are,
right behind it.
They are right behind it. And again, the more we sort of flood the space with more options, hopefully that'll drive costs down eventually.
Yeah.
Right.
Potentially a lot for people who don't like noodles and other things.
Exactly.
Could be a big deal.
Are you available in 10 minutes? We might need you again. In like 10 minutes for a story.
I actually am.
I might need you for Pop Star.
Okay.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.